Good. And thank you all for being here today. We're really excited to be able to have this discussion and panel on a very important topic about diverse and healthy communities here in our very own Los Angeles. And so we want to dive in and not take too much time so we can really get into this discussion. But we have with us here today three very great panelists that's going to be sharing their perspectives. And I won't go into a big bio for them because they're going to be able to share what they do best as we go into this. But quickly, we do have Deborah, who's the CEO of Westside Family Health Center. We have Diane, who's the project manager at Hawkins & Brown, and Camille, who's founder and creative director at Q26. And so we want to take time to jump in and get right into this conversation. And so to kick it off, we want to take some time to see what the perspectives of each of our panelists are with this discussion. And so the starting questions going to start off to begin with, through their perspectives, what are two components that you each see essential in ensuring a diverse and healthy community? So what is a diverse and healthy community to each of you? And so I'm going to toss that one to start off with Deb, and then we'll go around and see how we can dive into this discussion.
Thanks, Josh. I appreciate it. And it's great to be here. I'm going to go with three things, actually, of what helps us work in what we do. So I run a fairly qualified health center, a community health center in Culver City. It has about 13,000 patients. Diverse, but in our our teams actually reflects the diversity. And one of the things that's really important to us is that exact thing, is that our team reflect the diversity of our community and that we have the cultural competency within the community to meet their needs. What was important to me, we just left Santa Monica after 47 years in a very small site. For instance, our clinic was 1,500 square feet and our total site was 6,000 square feet. Our current site now is 24,000 square feet and our clinic is 12,000 square feet. So, but what was important to me is to keep it friendly and kind of homey, but also to show how much we respect our patients. Because I think it's really important when you're working with a diverse and especially a vulnerable population, particularly over the last 4 or 5 years of what's happening in this country, that they really need to know that they're respected members of the community and that they have dignity and that we respect that dignity and we respect them as community members. And I think if we can do that, then that makes it seem more inclusive within the community and they feel more like community members. And I think we've done a great job, not just in the building, but how we provide services. So.
That's good. I think that's very, very important. Being reflective of the community and the work that you do is a really big piece of how to make sure that these communities are being seen and heard. Camille, I'm going to toss the question over to you. I know a lot of what you do focuses on communities being able to be seen and heard. And so through your perspective, and tell us a little bit about your work and how you see these different components being essential to diverse and healthy communities.
Yeah, absolutely. So I think that two of the most important things in having a healthy community is making sure that the community has access to opportunities in education, like really actually good education, not just here's the school and go there because you have to, because it's the law and that's it. And then the other thing is having people actually have input in how their communities are designed and built. I've worked in the past for an affordable developing organization, and I've also worked for the city, and I've seen it happen where sometimes the outreach, particularly in figuring out exactly what a community needs, sometimes it's really great. Other times it's really lacking. And when it's lacking, it's usually because the person who's in charge of the project either thinks that they know more than the community knows about their community, or they're just being lazy. It's one or the other. And either way, that kind of really needs to stop, because the only way we'll see communities really grow and can become healthy if they're not healthy, is actually having people be able to put that input in. And then going into opportunity, when you give more people opportunity, that just helps with their health at home, like outside of healthcare facilities, which are immensely important. Being able to feel like you're okay, like mentally, that helps everything. That helps you physically, that of course obviously helps you mentally, and it helps you be able to put more input into how your community looks too. If you're working all the time and stressed all the time, you're probably also not going to have a lot of time to be like, okay, now I'm also going to look into how I can build up my community, because you're trying to take care of yourself. So yeah, I think those two things are super important.
Thank you. Yeah, and I think that that's a really, really great point about the way that we speak, the way that we educate, the way that we are able to help give the access and opportunities to community as well, is a way to build it up in that way. Diane, with the experience that you have, not only on the architectural end, but also your own personal experiences, how do you see healthy and diverse communities?
I definitely want to echo everything Deb and Camille said previously, but I am so I've been working. I'm a project manager at Hawkins Brown. I've been working with the UDC for the last couple of years, but I'm also a board member of the Laotian American National Alliance. And so in the last year with the pandemic, we actually worked quite a bit, not only on issues of mental health and access for our community, but also just like the census, because it's not just about access, but it's also about giving people voices and making sure that people are visible. And the people who are able to advocate for the community need to advocate not only for the community, but then also help people gain the voices to advocate for themselves. So that was a huge thing for us, was just learning about how people have limited resources or access to the resources. Even if there are resources out there, if you don't know that those resources are available to you, there's no point in having resources available to people, So that's a really big thing for me. I think I've learned through the years to advocate for myself, and I've been privileged enough to have people around me in my circle to advocate for me, but there are a lot of people who don't have the same advocacy. So access, visibility, and I think in that you get a level of advocacy too.
That's good. I think advocacy is definitely a poignant point that rings through what each of you all do. On that note of advocacy, how do you all see advocacy playing a part in the work that you do, and how is that personal experience and work experience able to develop this ideal healthy community? So whether that be an anecdote about something you've seen in your experience, or just an ideal that you guys are pushing towards. Whoever wants to jump in for this one.
Yeah, I think that, one of the things that health centers have been started to focus on are the so-called social determinants of health. So you'll hear that thrown around a lot. And so, you have food, you have housing, you have education, you have environmental, climate, just a whole series of things for us to look at. And it's hard for us to wrap our head around sometimes, but it does affect so much in justice, racial inequality and racial justice. So we have kind of expanded our advocacy program to include anything that, and we'll work with legislators or work with our supporters on getting the word out on anything that we can that really affects a person's well-being. And I think that's what I want to say, it's more than just physical or mental or emotional health or oral health. Somehow the head got separated from the body somewhere down the road, but it's really the well-being of someone. And that goes back to the community. And, you know, like Camille said, if you're not getting the best that you can get, it's really hard for you to be well and to feel good about yourself. And how do we do that? How do we make those changes? You know, I have 80% of my board members are patients. And that's how we get a lot of feedback from the community, because they're patients of ours. And they do not hesitate to tell me in the middle of a board meeting or anything what we need to do, but they're great advocates for us too. They're great advocates for us in the community, but they're great advocates for the community coming back to us and getting that message out. And so we really need to focus on, as healthcare providers, it's just a bigger focus than healthcare. You know, healthcare is really about the whole person, and how can we make that work? And so we're trying to develop programs that the community and our patients and our team can participate in. And I think then that empowers them. You know, that's part of our mission statement, is to empower our people. And that's what we try to do.
Yeah, I'll jump in here. So with Q26, we had a blog and a magazine over the past couple of years, and the magazine gears towards queer people of color primarily. And what we did was we gave opportunities for writers to write, and we would publish them in our blog, and we would, you know, throw that around social media and so on and so forth. And it was really cool to watch how these writers, these early writers who wrote for us, to see them grow and to see them become more confident in their writing and start writing elsewhere, and see them starting to get more opportunities outside us. And even now, like we're moving more so into filmmaking, because there's loads of opportunity for writers, for designers, for pretty much any creative under the sun. There's an opportunity within filmmaking. So we're gearing that way. And one of our programs right now is called the Filmmakers Club. And even there, like watching people grow in that program too, and also become more confident and more excited and actually get work done, and talk about their goals and feel excited about that. That by itself has been really, really amazing. That's just growth. That's just in part opportunity, and helping people realize that things are possible, and sending them towards resources that they may not have immediately available to them.
For me, a large part of my career was actually at Bricks and Scarpa Architects, where we did a ton of affordable housing. I was a project manager on the 6 with Skid Row Housing Trust. Did a project with Venice Community Housing as well. And there, those projects it was easy to think about diversity and community and do something for the greater good, because that was the brief of the project, right? But now I'm at Hawkins Brown, and we're working on a lot of private developments where that's not always the priority. And I think as architects, projects come to us. We all chase work, but when the projects come to us and we don't really have control over the priorities of that project, all we can do is kind of do the best to push the client in the direction that we want to go in, or encourage the client to see alternatives that will be both beneficial to their project, their profit margin, as well as the community at large. And I think one of the things that we need to do as architects is also celebrate like the small wins. Like sometimes you get the easy big win, but if you get a small win, that's just as great. I think is, you know, we take all the wins we can, from like pushing for more open space to, you know, pushing for more natural lighting, little things like that, where people are like, you know, it's quite typical for developers to come in and just want double loaded corridors so that they can maximize the footprint. And you're like, well, how about we open some of this up so that people can have natural ventilation, natural lighting, and those are things that heal people as well and contribute to the well-being of a person. And it's a small thing for a person to get daily, but it makes a huge difference in the long run in people's health and mental well-being. So I think small wins are just as important as big wins.
That's very important, very important. And I think bringing it back into the built environment, and how that actually can help with the health and help with just the mental well-being of the community is really important. I know, Diane, for you, it's directly in the architectural world and the built environment. But Deb and Camille, I know, Deb, you're speaking on earlier about how the physical building that you all have now, and how that's been a change from the building that you had before. And Camille, I know you have a background in historic preservation and how that world of being able to preserve the history of different communities and spaces like that. So specifically to you, Deb and Camille, how do you see the built environment playing a role in healthy communities now?
So when we moved, first of all, we moved March 28th, 29th, and 30th of 2020. If you can even imagine having to move in the middle of a pandemic, at the beginning of the pandemic. But we wouldn't have been able to provide the care in our old site if we had not moved, because we only had 15,000 square feet and we couldn't have done it. So we're we wanted to be able to offer a concierge type service, which meant, greeting the patients at the elevator, walking with them through, paperwork. They're all assigned a team that works with them. So every time they come in, they see the same team of people. And there's always someone in the room with them. All of our exam rooms are on the outer corridor, so they all have big windows and lights. We're the old LA Weekly building at Sepulveda and the 405, for those of you that know that area. Great lighting, great rooms, and they just don't even look like exam rooms, except they have this table in the middle of them. But like the pediatrics area has chalkboard walls for the kids to play on, and there's huge screens in the room so that when the provider is on their iPad entering data about the visit, the patient can actually see what's being said, and they can, take part in what the comments or what the progress notes or whatever are. And it was just, so the design that way, and then everything happens in the room. You're not going here to get your blood drawn, and you're not going here. I don't know about you all, but I personally don't like to be out in the corridor while they're taking my weight all the time. That's nobody's business, not even mine. But anyway, everything happens in the room. And so it's very, personal and private. And then when they get ready to exit the room, if they need a nurse to come in and help them, talk to them about their meds or anything, it all happens right there. And then they're escorted out to the elevator, and any appointments made in the room, escorted out to the elevator and wished a good day. And we are able to do that because of how we designed the building and how we set up our workflow and how we planned everything. Was it perfect? Is it perfect yet? Probably not. We probably still always are tweaking, but it's so much better than it was. And our patients feel so much better than they did before. They're getting the same quality care they always got, but they feel like it's better care because it's a better setting. And that's really important. That's really important to me. So, we have 70% of our patients, which if you're a Kaiser member, this may not seem like a lot because you're probably all on portals or UCLA or whatever. But 70% of our patients are on our patient portal. They can access their medical records, their lab results, they can talk to a provider, they can access health information. That's a lot in a population that 93% live at 200% or below of the federal poverty level. You know, about 23% are monolingual Spanish. And, you know, everyone is really just working extremely hard and doesn't really have the time. And we're also able to offer telehealth visits now. And that's a really big deal. So during the pandemic, we were doing up to 90% of our visits were telehealth. And we were able to provide scales, glucometers, blood pressure cuffs, pulse ox, and thermometer to our most vulnerable patients. So 200 of our elderly patients where packages were delivered to them in the middle of the pandemic that had all this equipment with them. So when they had a visit with their provider, the provider could see what they were doing, and they could, you know, look at the numbers and everything. And this all makes a big difference in how we provide healthcare, but also in how our patients feel.
Yeah, on my end, I kind of have to, speaking of heritage conservation, I kind of have to jump into that and then just personal experience. So, I mean, California, way back in the day, was kind of like a place where people went, like for tuberculosis, for instance, because it was sunny, it was warm, the temperature was moderate, so on and so forth. And you had a lot of like modern architects who built houses that did like allow for a lot of open air, open light, like comfortable spaces. And we admire those houses and we look at them and we protect them and we save them and we're like, these are so cool. But the problem is that they're in very specific places, and they are not available for everyone. So they're on pedestals and they're available to some few, like those kind of environments, but very much not to anyone, or not to everyone. I grew up considering myself to be very lucky that I had access to Kaiser, because my mom was a LAUSD teacher. And so I'm like, yes, Kaiser's great. But I do remember the brief period of time in grad school. It was between me being 26 and not having healthcare anymore during grad school. And so I was on Obamacare and I had to go to another hospital somewhere in Downey. I don't remember which one it was, but I remember going there and feeling so uncomfortable and kind of having to realize that that's the kind of hospital that a lot of people go to, these really uncomfortable, extremely sterile places where no one seems to have any time for you. That was the one and only time I went to the hospital, was when I went to get like, I don't know, I think it was like my vaccine card updated or something. And that makes a huge difference. The thing is that a lot of these resources aren't available for the communities that we're talking about, for diverse communities, and they kind of really should be, because that's probably part of the reason why people hate hospitals, honestly. The one that Deb, yours, it sounds amazing, honestly. And we definitely need more of that.
Yeah. But those hospital experiences should also not be acceptable, right, Camille? Like the fact that you felt that way in this country, in this day and age, like how is that even okay? I'm just going to take it back to something personal for me too. I am with Kaiser, and I feel really privileged to be able to have access to medical care pretty much anytime, anywhere in this city. My mom lives in Fresno, where there's limited Kaiser facilities. And when she learned that I was with Kaiser, she was just like, are you sure that's the right, the right care you want to be under? Because she's used to having only one Kaiser hospital available to her. And she's like, it's on the other side of town. It's not accessible to her. But recently, she actually got hurt at work. And she was calling me while I was in the office, and I knew something was wrong. So I picked up, and I had to translate for her. So communication was a huge deal. Like she speaks English fine, but when it comes to medical terminology and also sharing how she was feeling. She stumbled, and she would like tell me in Lao how she was really feeling. And then the doctor is in the same room and she's telling him that, oh, it's okay, it's not that bad. I'm fine. And I'm like, no, mom, you just told me that you're dying right now. Like you're in
Right.
incredible pain. Like, why are you holding back? And it's this, I don't know if it's a level of trust. It's definitely a communication barrier. It's not like, and it's possibly the setting. Like she was in a, it wasn't her regular doctor. It was a vocational health doctor. And, like those kind of settings definitely change and trigger a different kind of response. And like I said, I've learned to be able to speak up for myself. And when something's not right, I can really advocate for myself, but she could not. And so luckily I was on the phone with her and hearing her say, pull back and say the wrong things, not necessarily the wrong things, but like giving the doctor incomplete information. And so here I am trying to like translate for her and advocate for her at the same time. And, when we hung up, she was like, I'm really fortunate that I can call you. A lot of people can't call someone to help translate. And even if you get a translator, it's not necessarily someone who is advocating for you. They're there to translate. They're not there to actually interpret and make sure that you're going to be okay at the end of the day. So um, that was eye-opening for me. And that's my mom, having been in this country for almost 40 years and still struggling to get the health care that she needs.
Well, but I think you had a really good point when you use the word advocate, because that's one thing that people don't do enough. They don't
Mhm.
advocate for themselves. They have these providers on this pedestal, and having worked with providers now for 40 years,
No.
no, take them down. They only know what they know. I mean, medicine is a science. So,
Mhm.
it's kind of a process of elimination and knowledge and studies and everything, but they don't know how you feel if you don't tell them. They don't
No.
know what's really working for you. And so when we talk about advocacy, we have a tendency to think about advocacy in terms of legislative victories and all
Mhm.
this, but it's so much more than that. It's teaching people or empowering people or giving them permission
Mhm.
to tell us what they need and how they feel. And I think that's a community thing, and that's also a cultural thing, because there's certain
Mhm.
cultures that have very defined hierarchies, and medicine is in that hierarchy. So one of the things we've learned is that our medical assistants actually sometimes know more about the patient than the doctor does, because the patients are more willing to speak to them. So we hold huddles twice a day for our morning and our afternoon sessions, and they review each patient file and each patient's story, so that people kind of know, if the doctor feels they're having a hard time finding out some information, then they encourage the medical assistant to see if they can find out. So it really is a team approach, but the patient has to be part of that team. So I commend you on trying to get your mom to speak out, because I think it's just really important. And that's how you build these healthy communities.
Yeah, I
I
think a
was
key word that, oh, sorry.
no, go ahead, go ahead.
I was gonna say, I feel like a key word there is permission, in terms of giving or making patients feel like they can advocate for themselves too, because it could be really scary if you're in there and you know something, but you also know that the medical community has not always been kind to people of
Yes.
color, no matter
Yes.
what it is that they've said. So I think that I absolutely agree. Like as patients, we need to know that we should advocate for ourselves, but we also need to make sure that the places that we're advocating for ourselves in are also safe places where they
Yes.
will actually take into account what we're
Yeah.
saying.
Yeah, I agree.
That's a very good point, and that leads into a little bit what I was about to say. I really would like to stay on this point a little bit longer about really understanding what the community needs themselves and how to be able to take that and translate it into into the quote unquote power that each of us has because of the positions that we're in. And so do any of you have any best practices, I guess, of being able to really reach out to the community, hear what they want, and being able to put that into practice in each of the ways that you all are working? And I think something, I guess, to point this question a bit more, Diane, we spoke recently and you talked a bit about a project that you had where it was specifically for youth and the community needed something more so for adults. But could you touch a little bit about that and you use that as a lens to talk about what the community needs and how you were able to work through that?
Yeah, definitely. The project Josh is talking about is Engine Company. It's a brick carpet project, one of my last ones there. And it was a fire engine, a historic fire engine, the company that was going to be converted into Youth Arts Center in Skid Row. And of course, the community within Skid Row really was pushing for adult services. But this was part of a measure that was passed some 20 years ago. And there was no way that this project was going to become an adult center just because it was already written into law, essentially. And this was going to be a youth arts center. And so we got a lot of pushback from the community because everybody was saying like, well, there's not very many children here. Like, what are we doing? You know, that we need adult services. And I remember that in particular, we went to a public meeting and, you know, again, some of the most vocal people in the community got up, told, had their case, definitely were speaking for the adults in the community. And then there was this grandfather with a little boy, I don't know, 2 years old, however old he was, a little boy. They went up to the front and the little boy, who was so excited to have an audience, started to do a little dance and like was just like this happy little boy. And he was incredibly adorable. And the grandfather said, this is why we need this youth art center, because this boy needs somewhere to go. And I need him to get out of this. I need him to have more opportunities than I did, you know? And it was like, who could say no to that? After that, it was just like, yes, I don't care if it's just one little boy. If it's just that little boy that goes to that youth art center, then it's well worth it because it's one less little boy that has to grow up to be an adult that is now back in the same situation. And it was an amazing night for the project, you know. And yeah, the project itself was going to service, you know, I think after the studies were done, less than 100 children in the area, but it's 100 children that wouldn't have had services otherwise. So it was an incredible process to go through. And I think, again, it's access and resources and understanding that those children have the right to that service too, you know?
Yeah, being able to advocate for people that sometimes can't advocate for themselves, in this case, being children is very important. And yeah, so to push that question along a bit more, as you mentioned before, Camilla, a lot of what you're doing is giving a voice through, whether it be through film, through writing, and different ways of being able to give the voice to community. As you've gone throughout that process, how has it been being able to have that platform, and has there been things that you've changed in that platform because of learning what those voices wanted and how they wanted to be heard?
That's a lot of questions in one.
It is. It is.
So yeah, I suppose, I don't even know how to start that, honestly. So I guess the main thing that we did, as mentioned, like we started with a blog and with the magazine. After we had the blog and, you know, started realizing what we could do with it and how many people it could reach, what we started doing was building these programs for folks to actually be able to, you know, write and create things and be able to get that out more effectively, and also have it be something that they could put on in their portfolio. So, and And every time we have one of those programs, we have time at the end where we ask, how could this have been better? How, if you could change anything, what would you change? How would you improve this? And whenever people, say this was great, you could work on this though, we listen to that and we change and we adjust and we make things better. If we have someone who's saying this is not clear, then we try and make it more clear. If we're noticing that one thing works better than something else or has more impact, then we switch or we gear towards the thing that has more impact. It's not just us. We're not just thinking about ourselves because it's not about us. It's about the people that we're servicing and that we're helping, grow as creative individuals. So it's really, really about listening to what people are saying and taking it to heart and actually making it a part of our program so that we can make it better moving forward.
That's really good. And Deb, you touched on it a bit earlier when you were speaking about telehealth and the different things you all did last year. We all know last year was very different for every industry. The way we all had to shift the way we did things because of all of that was shifted over to virtual, and tying a bit to what Camille is saying about how in order to make a better and more impact, you have to listen to what the patients, what the community, what the users, the readers, what they want, and it may sometimes shift what might be best for the bottom line of the business or the clinic or different things like that. Outside of telehealth, is there any one thing that you can point to that really changed that you think you all will implement go home and further?
Well, telehealth obviously is getting cut back a little bit simply because people are willing to come in. But one of the things that we did do, and it unfortunately ends tomorrow is the last day. In October, we partnered with UCLA Food Services and Venice Family Clinic, and we offered 1,500 meals a week to our patients. So we gave out almost 50,000 meals since October to our patients. And, that was a game changer for them, because most of them either had no jobs, they had COVID in the family, and there are many times we actually delivered to the house or to the apartment and left them outside. But that was a game changer, and it made us realize that we really needed to up our food game moving forward. So we're now trying to work with some agencies to do pop-up sites at least once a week where we can offer fresh fruit and vegetables to our patients. And that's a real push for this next year. And then maybe start a food pantry of non-perishable goods so that people that need that can get that. And so I think that is one of the big changes. The other thing is we increased our mental health staff. We only had one person at the beginning of COVID. We now have two, and we're getting ready to add a third. So that, at the beginning of COVID, at least she literally started April 1st. So, so we're able to now provide mental health. And then this next month, we're actually starting oral health. So, all those things that our patients need and how we can get those. And we're trying to figure out a way to do our mammogram program started back up, because I'm sure you all know that cancer screenings really, fell to the floor during the pandemic. So just trying to really reach those patients. One of the things we did is that every patient, all 13,000 patients, were called 5 times over the course of the first 7 months of the pandemic. The first 2 weeks of the pandemic, everyone was called just to check in. Are you okay? Do you have any questions? What can we help you with? We do masks. We have, thousands of masks that we still give out all the time to our patients and to our or food service people, hand sanitizer. We just have lots of that type of care packages that we do all the time, and we're going to try to continue those because the pandemic is far from over, everyone, as you all know. And so I think it's just taking what we had and just making it longer term, you know, trying to really look at people and what their needs are and how can we alleviate some of the stresses that they have. People shouldn't have to worry about buying masks and hand sanitizer, and, you know, women shouldn't have to worry about feminine hygiene products, and moms shouldn't have to worry about, you know, feeding their kids. So how can we do that? And, you know, one of the things we're trying to do is come up with some video presentations that we can put on YouTube. Actually, we do have some good things on YouTube, but do some cooking type of things. So to try to help people that, you know, with limited income to still cook healthy, because that's a real, that, you know, that is an issue. And I think that with the food, with the pop-up and the, if we can do the fresh fruit and vegetables, there'll be some demonstrations there of what people can do. So it's just this constant trying to think, how can we improve a person's well-being? And how can we improve our own team's well-being? Unfortunately, a lot of times our patients are reflective of what's happening in the country overall. You know, they're angry, they're rude, they're abusive, quite frankly. How do we work with that? But how do we protect our people? So we're developing an 8-week, once a week series, one time a week for 8 weeks series for our team of a drop-in at our site that they can drop in with our mental health professionals over a 2-hour period, just so that they can, you know, talk about some of the issues that they're having and work on that, but also 15 minutes a day of breathing and mindfulness that we'll put aside. So it's really just trying to meet the needs of everyone. Now, I have to be, this is a disclaimer. I got kicked out of my office on March 11th of 2019 because of some conditions I have. And I went back for the first time Saturday. Saturday was the first time I had seen my building. And I only saw one floor. I'm saving the other floor for this week, but I literally cried all around the floor the whole way, you know. So when I go back, I start going back once a week. I think that I'll learn more and more, and I'll see more and more of what I can do to really make this a safe, because Camille, I think safe is really important place for our patients and the community and our team. And that's what I always wanted. I always wanted a place where people felt safe.
Wow, that's amazing. I mean, the impact that you and your team were able to make over this past year is that's.
And we did not furlough or lay anyone off during that time.
Wow.
So, yeah. So my bank account went down a little, but we still managed to keep everyone in. So
that's great. That's great.
Thank you.
I think something that is really important to JEDI, our committee in AIA as well too, is the idea of figuring out how we can push forward what we learn about into actual actionable items. And being that the majority of people on this call are in the architectural background is one thing, but also personally, I really believe in the idea and the ethos of a citizen architect, a citizen designer, where citizen is the first word, and that being part of the community. So, and what each of you do is there ways that all of us on this call, whether it be you utilizing our skills in this design industry, or even our skills just being human beings, how we can get involved in the different things that you all do?
My guess is we have volunteer programs. Camille, you have a volunteer program?
We do, yeah. Yeah, that would be great if you if there's folks who are creatives or at the very least could talk on mental health that can, join our calls, particularly for the Filmmakers Club, because that's the one that's going on right now. That would be awesome because, creatives are not exactly known for being the most sane people in the world. And partially just because of the industry itself, which, pushes that you should always be working and not sleeping and, like doing these things that aren't really actually healthy for you or beneficial generally to your artistic practice. But it's that constant push to just keep producing. And there needs to be balance for mental health and time for rest and for taking breaks and really being able to take care of yourself while you're making things. So so having people talk on that would be amazing. And then I guess as a general thing, I would really like to see more spaces that gear towards transitional age youth, whether it be health or housing or centers, because it's like Diane was saying earlier about the little boy in the arts center. If you start on that road, that the thing with I guess with poverty and with homelessness is not just that someone grows up and becomes homeless. There's a whole process there. And oftentimes it starts in childhood or in young adulthood where people just get lost or they get lost in the system, really. They don't receive the resources or the help that they need. So being able to reach folks who are transitional age at that time and giving them a step forward, a foothold, so that they can actually have more of a chance to succeed and to be able to do what they want in life, that would be amazing. I think we need to focus more on that. I guess particularly in affordable housing. I know there's a few projects that's happening that are geared towards TAY youth and towards prior foster care kids. We should definitely see more of that.
I know we have a long ways to go, but I'm really excited to see what's going to come out of Triple H, and I forget what the other acronyms were that the measures but in theory, there's a lot of affordable housing coming out in the next couple of years, and I hope that we as an industry have done our part to really push for something more than just a place for people to put their heads down. It's not just about having a place to house your things. It should be a place of rehabilitation and growth and provide people with the foundation to move forward. I wanted to talk really quickly about the 6, which was a project, again, with Bricks and Scarpa. It's a project I will forever be proud of because we really achieved a lot with that project. It was just a box, but it was a box of that was a series of frames. It's a podium project, super basic project, but in reality, it provided a lot of safe spaces for the people who live there now. One of the things that we accomplished was just elevating with the podium project and the frame. We allowed people to be elevated into the space. And so there was a connection to the street level that they still maintain as a community, but you felt separated so that you weren't on display. You were still in control of how much you were being projected into the community. That was something we knew going in, that was the goal. We didn't realize how well received that would actually become, and it became a really significant part of the project and a measure of its success, really. And one of the other things that we didn't realize would be so big was we had a rooftop deck. And one of the project managers for Skid Row Housing Trust ended up telling us later on about how a lot of homeless people, they live on the streets. So their world is 6 feet above the ground. That's it for them. And to have that rooftop deck for them to be able to go up and see the rest of the city that they are part of, changed their perspectives tremendously and really gave them a connection to the space that they never had before. And it was something that really struck me. Like when I heard that, I was just like, I didn't understand that that could have such a huge impact, but it really did. And it went from being just a, you know, your basic open space to something that, you know, was treasured by the community within the building. I think as architects, I think we should, whether it's commercial, residential, whatever it is, we shouldn't waste space. There should never be a space that's just there. Like I'm thinking about commercial projects in particular, where we design, you know, the envelope, and then we give people, tenants, like these blank floor plates that they can do whatever they want with. Yes, that is part of it. Like you want people to be able to come in, different tenants to be able to occupy the different spaces for the long run, for the into the future. But at the same time, we should also, again, like a small win, build in program that helps with mental health, that gives people access to outdoors or like open space or natural lighting as much as possible, like program as much as we can within the parameters of the project so that it ensures that that building is promoting a healthy lifestyle for the people who occupy it versus just giving a tenant, you know, a blank space to have to figure out later on if that is a viable thing for them.
I'm going to piggyback a little bit on that. I do believe that we need more open spaces and they need to be green. I mean, I know we live in a desert, but you know, I remember when I first moved to LA in the 80s, and I would drive down to what used to be then the Martin Luther King Hospital, and I would drive down into the area, and there was like there were no trees. It was just cement. It was cement everywhere. Yeah. And then I'd see these big empty lots, and I found out later those lots have been empty since the Watts riots, you know, that something burned down there and they didn't do anything with that space. Why weren't those community gardens? Why weren't we growing food for the community or allowing them to grow their own food? Everybody in that area would love probably to grow their own food. And we don't have community gardens. We don't teach kids how to grow their own food. We don't use our seniors so that they can help younger people learn about some of the skills that they had, and that young kids can help some of the seniors with some of the new skill sets that they have. And we don't have that. So we have all these senior centers, you know, like Culver City has a big senior center at Memorial Park. I don't think they have a youth center. Why don't we have youth centers? Why aren't they everywhere? Why don't they include, you know, gardens? Why don't they include mental health professionals being there? Or we have a whole outreach team that are nothing but under the age of 25. And they really like, you know, we see 7 schools that we go into. We provide reproductive health services, and we provide a bunch of trainings and session, you know, responsible decision-making, you know, body image, the whole thing. Why aren't kids like that available so that they have peers, they can talk to their peers? They don't care what I have to say, quite frankly. Camille, you look half my age, probably even more, but you know, it would be better if they were like 21 years old talking to the 17-year-old kid or the 18-year-old kid. And youth centers that teach life skills. I mean, okay, I know they don't have checkbooks anymore. I get that, but I would like to learn what I'm supposed to be learning. But what are those skills that kids need? And maybe we ask them. I don't know what it is, but it's really important to me that we help grow people that can make a difference in this world. I don't have time for people that don't want to make a difference in this world. I have a lot of time and a lot of patience with people that want to offer something back. And how do we do that? And I think centers are one of those. And I think youth centers are one of those. And and, working with children aging out of foster care. But it's not even foster care anymore. Sometimes it's even children just aging out of high school and they don't know what their next steps are, and how do we help them? Where's the vocational education that kids might want? Where are the apprenticeships that kids might want? Maybe that's an idea for what you all can do as architects or something. What are the apprenticeship programs for young kids? And I'll end with this. We used to do a peer education training class, and it was a 40-hour class. And when you left, you knew everything that you needed to know about sexuality education to talk to your peers in high school. And we promised those kids that when we had a job opening, they would get extra points for being part of that when we went to hire and they came in to interview. So we hired a young woman right out of high school. She started as in the community outreach and education program, going around doing outreach. Then she became a community health worker, a medical assistant. And then she became my assistant. And then she became the administrative officer. And today she's my director of HR. And that's a story that I keep wanting to tell. I have nurse practitioners that started with me as volunteers, students. So that's what we want to do. We want to create that I call it the team approach. I grew up with a famous swimming coach as a father. So I call it this team approach, but that's kind of how I look at our community, is that we need to be a team and we need to be uplifting for each other and really promoting each other and really trying to be the best that we can be. Okay, that's my speech.
I couldn't think of any better way to wrap this up, leaving it with that. I mean, that's what it's all about, is to be able to create these spaces and create these places that allow people to feel empowered to be the best that they can be. And so with that, I definitely want to thank each of you and just the perspectives you gave, your experiences, and the work that you're doing every single day. I mean, it's extremely important what each of you do, and I think it's very, very inspiring. I've seen a few things in the chat and just people talking about how it's giving them hope again, how it's allowing us to be able to think about the ways that we can be involved in helping these communities grow and develop in a more healthy way. And so definitely want to thank you, each of you, for your time and for just being able to share your thoughts and experiences with us.
Thank you very much.
Thanks for having us here.
All right, with that, we will wrap it up and hope all of you have a great night, and thank you for joining us.